when we're doing our launch May 1, May 1 through July will be beta phase as we're ramping up quickly. And, all of us at this kind of initial stage are going to get perks and better reimbursement and kind of be part of this, movement that's growing through 49 states. We're in several states across these United States now, and California is our focus. But again, we're growing. We have a Florida presence, North Carolina presence, Texas, and so forth. So I'd like to start with Dr. Chris Esquera, our SVP of Healthcare Services, and just a background, doctor, so that everybody knows, the supportive structures and who all we are here.
Okay, great. Hi, Chris Esquera, psychiatrist by training. Have worked in leadership in both on the provider side and systems, as well on the health plan side. And happy to support this effort and actually get into developing this network that actually is more comprehensive than typically what the plans have to deal with.
Thank you so much. Caitlin?
Hi, I'm Caitlin. I'm a physical therapist. I actually live in Ohio, so that's kind of a fun fact about me, but I'm licensed in California, obviously. I have been, previously I was at 2 different skilled nursing facilities, and one focused on patients with Alzheimer's and dementia. So I have a lot of background in that. And then I've also been working with another telehealth company called Physio, treating workers' comp patients and various orthopedic injuries, as well as concussions too, which is interesting because I didn't know how that would go, but it's actually gone pretty well so far.
Wow, cool. Thank you so much. Welcome. I'm so honored to get to know you. Thank you so much for joining the network. Thank you. Janet? Hi, Janet.
Hi, I'm Janet. Hi, Alex. I'm from San Mateo, California. I'm a registered nurse and a certified diabetes care and education specialist.
Awesome.
And I've been a nurse for over 15 years, and I'm excited to be here.
Welcome.
Thank you.
Thank you. I almost want to ask an icebreaker question, like hidden talents. Can we do that? Is that corny? I'm thinking of this. Yeah, hidden talents. Or any other fun fact you'd like to share. Caitlin, thanks for setting that precedent. So,
oh, you're welcome.
Janet, do you have a hidden talent? You don't want to share? Or anything that excites you, like your favorite type of patient or something, just something additional.
No. Let me see.
No? On the spot? No? Okay.
Yeah, on the spot. I can't think.
Okay.
But
it's okay. It's okay.
But I really, I like people that inspire me. I like to know their story and be motivated by that.
What's your idea of an ideal leader?
Someone who's willing to listen to people and open to suggestions and always want to do good and make a difference.
What is that one?
Yeah, sorry.
What is that one thing you wish you had as a clinician that you've not had or not been provided with that resource? Let's ask that question from everybody. Yeah, what is that one thing that you wish you've been provided with and you have not had access to? Nothing? Wow. So you've been provided with everything oh my God, that's great. What is that one thing you wish you had and never had? So if you could think of anything, let me know so that we can, structure the organization so that you could be provided with a concierge service. I want you kicking back in Fiji and doing your telehealth if you'd like, wherever. Maybe you don't like Fiji. I don't like the Beatles and stuff, but whatever you like, wherever you like. So thank you so much for being great sport and answering on the spot. Caitlin, what is the one thing you wish that you had as a clinician that you do not have or not have had?
I feel kind of with this, what you guys are pushing, just having a care team that's right there that I can go to if I need to ask questions or something. Because with my previous companies, I feel it's always phone call after phone call after phone call. There's no one that's right there when I need them, sort of thing. So it's nice to kind of have, or it will be nice to have this group of providers together that I feel we can easily have access to.
Thank you so much. That's very helpful. Lakitra, yes. Hi, Lakitra.
Hi, how are you?
Hi.
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 So I'm a licensed professional counselor, and this is my 10th year. I'm in private practice now, so it gives me a little bit more flexibility in doing a lot of different things. And you asked the question about what are some of the things you didn't have. I didn't have a me. I didn't have someone I can go to or talk with or feel comfortable, you know, opening up to. I was always taught you don't tell anybody what's going on. You keep it to yourself. So because I didn't have that, I knew that was something that I would have benefited from, and I didn't have that. So I was like, what can I do to not have other people have that disadvantage that I had? So,
Are you talking about clinicians or patients not having that?
Patients, basically. I was one of the kids that probably needed to see a counselor. And it wasn't available to us. I mean, I guess it was, but then it was not, it was frowned upon, I guess, if I would say that. So we were forced to deal with it and keep going. And so I wanted to find a platform to where other people that patients or teenagers, because that's the targeted group that I really love working with, but I don't have any limitations, but I was that teenager that struggled because they didn't have that guidance. And so that was part of the reason why I'm doing this.
And we have a behavioral health segment that is focused specifically on foster children.
I worked for, well, I did that too.
There you go.
That was the job before this job. So
that's
yeah.
why we reached out to you. And essentially, you know, where are you based? Where are you?
I'm in Louisiana, actually.
Louisiana, yes. Yeah, and so we have a focus on, we have so many foci? I don't know. We have so many focuses that essentially something very near and dear is rural America, and even in metro America, you know, you have pockets. But you know, when I'm thinking of my nearest therapist being my aunt or my uncle or my grandparent, you know, is not something that's conducive, and you know, we've ignored these people. We have, and now we've made promises and we better deliver. So thank you for joining this network, and you know, we're paying specific attention to delivering these services to those who've not traditionally there hasn't been a business model for, right? So it is healthcare. Not everything's gonna have you know, a dollar. Anyway, okay. So I appreciate you. Thank you so much for joining. What is your idea of a leader, an ideal or a good leader?
Oh yeah, absolutely. When we were talking to Janet, she spot on. Listening was my main. That's the main thing, because we all come from different backgrounds, and some of us specialize in different things that I may not know much about. But if I'm not willing to listen, or the leader's not willing to listen and be open-minded to take that into consideration, then there are problems that happen. So when you asked that question and she said, great listener, that's always the top of the chart for me. Absolutely.
Thank you so much. Shirley, it looks like I changed my screen and folks are in different order. So I'm gonna go up. So next to Caitlin, I'm seeing Brittany. Brittany, please introduce yourself and yeah.
Hi, I'm Brittany.
Hi.
I'm a physical therapist as well. I've been practicing for about 4 years now. I've been a travel physical therapist. So I've worked in multiple different settings, from hospitals to outpatient orthopedics and home health. And that's why I'm licensed in multiple states as well. But what this company has to offer is the fact of being telehealth or remote, where, like you said, you could work from Fiji and still get the job done. Because I actually just got married back in February, and my husband is from Belgium. So I'm in Belgium right now. And I will be commuting back and forth for every 6 months or so here, and then back in the States for a little bit, and then back and forth for a while. So
incredible. Perfect. That's perfect. And we want to leverage your expertise, as you know, again, supply is low, diminishing, and outstanding. Thank you so much. What is your idea about, what is one thing you wish you had? Was it the virtual capability, it sounds like?
That, and then also what Caitlin's saying, the collaboration with all the different healthcare providers, because in every setting, even in the hospitals, it is so hard to collaborate with outside DME vendors, or in outpatient orthopedics, psychologist or anybody, or a dietitian, a nutritionist, just for to help the patient. Because like you said, you need to listen to the patient for the whole story to actually treat them. So I'm very passionate about that, like working as a team and learning in other different fields and growing, and at the end of the day, helping the patient the best that we all can. So that's what I really appreciate.
Thank you so much. Welcome.
Thank you.
Dr. Schmidt.
Hi, I'm Jasper Schmidt. My background is emergency medicine. I'm an emergency physician, and I trained in Bellevue in New York, which is a big city hospital. And you get, just a couple of minutes with the patient, and then you kind of wish them well and hope that they make it to their next step and, get their psychiatry follow-up appointment or their clinic appointment or physical therapy appointment. And we all know that kind of never really happened. So, I spent the next couple of years working with various health tech startups that really wanted to bridge the continuum between when patients leave an acute care setting and when they get to their next, physical appointment. How do we facilitate that transition? How do we make sure that do get physical therapy if they're there for back pain, or, that they can make an appointment in the language that they need in a timely manner. So, I've worked with companies that tried all different kind of telehealth solutions and, built really a human capital infrastructure around those patients so that, they can message any time of day and they can reach someone who can behind the scenes talk to a whole team of different types of practitioners to get the patient the care they need when they need it. And, we know that not everything has to be done right away. So you really have to build a team who understands the urgency of a patient's complaint, that's able to understand what the patient's, emotional state is, how anxious are they? How do we help get them to that next step in one piece and make them feel like they're heard? So it's much more than just the medical care we deliver. It's, how we deliver it and how we support that patient along their journey. And that's why I'm here to be part of Carenodes.
Thank you. Thank you so much. So Jasper, what's your idea of a leader, a great leader?
Of course, someone like you who listens all the time. You listen, even when I don't think you're listening, 2 days later, you'll pick something up and you recycle it back to me. Did I say that? I guess I did say that. So that's, a great listener is a great leader, of course. I think also you need someone who has a vision and really wants to drive the train, because not everyone can keep their goals in mind day after day, right? We're bombarded by, constant needs from every direction. And unless you have someone who can maintain the long-term vision and keep that focus, and, you do need to be able to vary that trajectory based on the feedback that you're given, but you need someone who really keeps that in mind at all times. So it's a combination of those things.
Thank you. That's very helpful. Thank you so much. And I look to surround myself with people like yourself who are smarter than me, yourself, because all these payments, I want to learn too. So thank you all for educating me. My team is on the line. You guys, I love you so much. I'm gonna go quickly so that I can, respect the provider time. Shirley is our provider experience advisor. She's the contact person. Shirley, introduce yourself, and then we'll go Shirley, Devin, Amy, Eileen, John, Ashton, just really briefly so that we can make sure we answer the provider call and then move on.
Hi, everyone. I'm Shirley. So most of you guys, I talked to you over the phone. And yeah, I'm so honored to be here today, meeting you, all of you guys, you wonderful people. So yeah, I'm the Senior Provider Experience Advisor for Carenodes, and I can proudly say that now. So yeah, thanks to Alex, and of course, Alex motto is internal customer service. So we really wanted you guys to be comfortable here at Carenodes, and of course, you can reach out to me. You can text me, email me anytime, call me if you need anything. So I will do my best to help you guys.
Thank you so much. Devin?
Hi, my name is Devin Smith. I am the network manager for the BPS network. I might have emailed, I think actually I've emailed just about everyone that's in this meeting right now. Yeah, just go ahead if you have any questions, feel free to contact me. I've given out my direct line. So anytime you want, you can text or call me or email. I'm here for you.
Thanks so much. Amy is she started like 2 days ago. So Amy is our accreditation person. She just came from, all of our team members have come from Optum. We have a mix. So all of us have health plan experience. I was running 28 clinics across California and Texas, 14 hospitals with the bundle payment program here, Dignity and HCA hospitals, over 50 skilled nursing facilities. And I went to Humana. I was a contract network manager for Hawaii, Nevada, California. So our team here is very well-rounded from, you know, outpatient to hospital to post-acute to plan side. So you're in good hands. We're not really figuring things out as we go along. You know, of course, we don't know everything by any means, but you know, we tee it up at the get-go because we have a lot of experience of what could go wrong. Amy is a recent addition to our team, and she's helping us get accredited with NCQA so we can be the best possible, you know, organization operating at that level. Amy, is that good introduction?
Hi everyone. So my name is Amy. Actually, my name is Amy Lilau, but you can call me Amy. And unlike everybody else, I haven't spoken to any one of you yet because I just got started. And as Alex says, I was working with Optima Rex. And yep, I'm working on getting Carenodes accredited with NACQ. But just like everyone else, if you need help or if there is something that I can help you with, please feel free to give me a ring. I'd probably, get in touch with you one of these days for you to get my email and direct number. And you can always reach out to me anytime. Just let me know. Thank you.
Awesome, great. Eileen?
Hey everyone, this is Eileen. I'm the Vice President of Carenodes, and I actually have to hop off in about 5 minutes. I apologize.
It's okay. John? Who's on mute? I could read his lips though.
Yes, yes. Hi everyone. I'm just excited, sorry. I'm a network management coordinator, and I'm looking forward to see how this biopsychosocial model works with the team that we have here, and to apply this holistic care with doctors and nurses and whatever providers will have. Reach out to us if you need everything. We'll get your record, and that's it. We're excited. We just want to get this done.
Awesome. Thank you so much. Ashlyn?
Hi team, my name is Ashlyn. I've coordinated with a few of you guys. Nice to see you guys here today. My main role here at Carenodes is kind of the bridge between the payer and our network here. So I kind of do all the administration functions, contract negotiations, participation request. So you might get some emails from me in the future asking for copies of licenses in case, one will, is expiring and needs to be renewed or anything of that sort. So I kind of am that gap between the payer, us, and just making sure, just kind of taking the burden off of you guys. You guys need the time to really provide care to the patient and don't have time for all the insurance headaches and things of that sort. So that's kind of where I come in, and I am kind of that gap and that bridge there between insurance and provider.
And just thank you so much, Ashlyn. You're amazing. Just to add to that, so the work that Ashlyn does to maintain your CAQH profile, if you work anywhere else or if you need to submit that, so that's going to be updated for you to the extent of the knowledge that we have. So you can also use that in, any other setting as a added benefit. So again, want to reduce the admin work, not just, in relation to Carenodes, but just quality of life, because we believe that internal customer service, happy, team, happy providers equals happy patients, and then happy society. And then it's not a rocket science, right? Deepa, I'm sorry that we haven't had a chance to connect with you. Please do drive safe. But we'd like to get an introduction if that's okay. Oh, but you're on mute, unfortunately. I'll click ask to unmute. Are you driving?
Hi.
Hi.
Hi. Sorry,
We need you.
since I was expecting the meeting on Friday, today's appointment was not manageable, but nice to meet you guys. Hi, I'm a physical therapist based in California. Hi.
Hi.
I hope you can hear me well because of the network issues.
Perfect. You sound amazing. You sound so good.
Yeah. So I'm based in California.
Oh, I was wrong. We could no longer hear you.
And I do have a experience in orthopedics and pediatrics as well. For 1 year, I have been doing telehealth because of the COVID issues. And then I do have an experience as PTA as well.
Awesome. Thank you so much. Wonderful. So now, we have 15 more minutes left. What I'm going to do is explain what's happening tomorrow. So we wanted to set it up for you so you know what Carenodes is. Carenodes is essentially a central entity that coordinates many organizations. So we're a network of networks, and that's a key to our market influence. It's really interesting. So PureWell Health is oh, okay. Deepa, I need to learn more languages, but okay, there we go. So essentially what's happening is that PureWell Health is one of our portfolio organizations. They've been around for 7 years. They provide virtual physical therapy. Again, traditionally as a vendor in the workers' comp space. Now, when they came to Carenodes during, this was pandemic era times, we looked at their, overall picture and said, okay, well, why don't you move into the, again, healthcare provider space? Let's get you contracted with insurance and allow more patients to benefit from this more conservative approach to lower back pain. First, it was total knee and hip replacement and, kind of a more complex setup, but lower back pain. So as opposed to, opioids first, well, lower back pain first, right? So essentially, we created care pathways, and these care pathways, are being now implemented so that it's more standardized. And this is the next Amwell of, physical therapy. Very good leadership. Again, they've been around for a while, and so again, they've been vetted through our program. Now, tomorrow, essentially, you'll be meeting with the Vice President of Growth and going through an onboarding, which you'll be reimbursed for. The onboarding is, there's CMEs that will be issued for nurses. I believe they're accredited to issue those for nurses. They're working on having CME accreditation for all specialties, so we can, again, provide as much value as possible. I don't know what other entity pays to also give the CMEs, but, that's what we're doing. Is this being recorded? Yeah, it is. Okay. Subject to change. Okay. So, only the first steps. Anyway, so basically, tomorrow you'll meet with PureWell. You'll get onboarded. I think you'll really like the technology platform behind, or at the center of PureWell, really. And I just wanted to tee that up for you so that you know exactly what's happening tomorrow, and that's pretty much it. I mean, that's the first health system we're bringing on May. In June, we're going to add more health systems. We want to do it, incrementally, so that we can make sure that the provider experience is in a way that is smooth, right? And that the scheduling. So the way it works is that you tell us the number of hours you're available and when you're available, right? And then we check in with our health systems, right? And then we book you for what it is that the health system's requesting. And your schedule for the month. It's not like, it's not Olive Garden. It's not, this is your availability, so be ready at any given point in time. Last thing, or you tell us, okay, Alex, I'm available 50 hours on these days. Okay, great. We immediately connect with our health systems. We come back and say, okay, please, block these times, and essentially we're paying you for availability. Now, you may see patients or you may not, right? You may just be made available as expert clinicians to advise our health systems. They're putting together their workflows, right? You might say, well, because you're the clinician, you're the expert, you're the PT, you're the folks who've been doing this. I have no business advising on these things, right? I'm very adamant about it. That's why we have two very high level physicians here on this call. And that's why we engage physicians all the time, because we want to make sure that, we're in the business of health, again, care. Yeah, I get it's business, but we're in health care. So we don't want to make the same mistakes other such organizations in technology have made. And so you might provide consulting, right? All within the same scope of the agreement that we have. So that's how it works. You get paid, like again, kind of, we're looking at, okay, how do we make the payments happen as soon as possible? I feel like that's what people want, quick payment. For right now, it's going to be once a month, so that we're able to, because people are going to have scattered schedules. So let's say you have 1 hour, in 2 weeks, and then last 2 weeks of the month you have all the hours, and then it doesn't make sense to pay all these remittance fees for 1 hour. So most organizations pay like 60 days, and they don't pay for no shows. And I've heard things like you have to see 4 patients in an hour to make your hourly rate, bizarre things like that. Yeah, I mean, just doesn't make any sense to me personally. It just, I would feel embarrassed offering that to my clinicians. So we're just doing a flat hourly rate. We'll take that risk. It's fine. And we'll advocate on behalf of our providers. You just be you, and stay compliant, and don't be on exclusion lists and stuff. And provide the care that you provide. And you guys are all seem very lovely. And I'm sure you are. That's it. I mean, there's no complication. In California, of course, California has regulations galore. It really does need to be a 2-party state. But basically what's happening is that, California has these regulations where, there are certain regulations, but basically our structure is in such a way where we are a network of providers. So, rest assured that our setup is in such a way where it's entirely compliant with all regulations in every state that we're operating in, and every state except Alaska. So you have multi-state licenses, your reimbursement will be adjusted accordingly, and so on. So that's it. You guys have any questions before I just keep going on? Because I get excited, I talk a lot. Any questions? So we're all ready for the tomorrow's PeerWell. So again, PeerWell, while it's virtual PT, that's easy to kind of just pitch like that. But again, it's a biopsychosocial model. So every Carenodes health system has biopsychosocial models. So, the patients who have MSK issue could very well have a co-occurring depression or whichever other, behavioral health issue, and it's manifesting as a back pain issue, right? So we provide that holistic care. We want to make sure, for instance, our behavioral health providers have ability to meet with their peers and cope with vicarious trauma, right? So, we want to have that interdisciplinary access across the providers as well as for the patient. So that's what I have to say. If you have any questions, feel free. Everybody will get an email with contact information, and have fun at the training tomorrow. And feel free again to give me feedback. What we need is we'll again follow up, so we get voided checks. I'm sure we do EFTs unless you want us to mail a check to you. Everybody, we'll email you, tell us how you want us to send you payments, but we do prefer electronic funds transfer. Definitely with international. I mean, Brittany, are you wanting things going to Belgium?
No,
right?
no,
Okay,
I have my bank account in the States as well.
Awesome.
Yeah, no
Wonderful.
worries. No worries.
Cool. So seems like Deepa has no questions, and no one else any questions. Wow. Okay, great. I've done a good job.
Oh, Alex, I have a question.
Yes.
What's
Janet.
your hidden talent?
What's my?
Yeah.
I don't know if it's hidden.
He's been waiting for someone to ask that question the whole time.
No. Let me see. I know how to sing, but I don't know if that's hidden because they might be able to hear me. Hidden talent. I know how to be a good follower. Is that a hidden talent? I don't know. It's a good question. I should probably have an answer to my icebreaker questions. That is a hidden talent. I don't have an answer to my own icebreaker question. I don't know if that's talent. I got to think about that. Thanks, Janet. I put her on the spot. Oh my God. And everybody shall get my cell phone number if you guys ever need to reach me. Very much, a good leader knows when to be a good follower. And my role is to set up direction and structures and move out of the way and let the team do their things. And barriers will come up, and for me to step in and remove those barriers and allow us to thrive. allow us to thrive. And if anybody has any ideas, you want to implement a program, the reason I left the corporate world and the, working for others world was because I was tired of fixed income. And I wanted to have variable income, of course, the base and then a variable income. So if you think of any programs you want to implement, let's talk. We'll connect you with the, appropriate team members. And if you want to implement the program in some market, then, let's do that and put you as, director of that project and come up with some other payment methods, and just feel free to innovate and be yourself. And if not, some people just want to come sit here, provide care, and experience the Carenodes experience, and that's okay too. So
I just say
a place
sorry.
up there. Let's make
Just
this somewhere that you have never experienced before in a good way. In a good way. Yeah. Go on, Deb.
Awesome. I just wanted to speak to the group. Real quick, side note, I've sent out emails asking for supplemental documentation. If you would just, I don't know who has and who hasn't answered, but if you haven't yet, or if you haven't seen the email, if you would please check for it and respond, please. Just a general thing. Sorry, continue, Alex.
No worries, and we'll follow up. We'll know who hasn't responded, and we'll follow up. Okay, so I want to be mindful of everyone's time. Dr. Esquera, do you have any closing words you'd like to share?
None other than, welcome. And I think, we're off to starting something new, different, and frankly, just a lot better than what currently exists.
Dr. Schmidt, closing word? He checks his head no. Okay, awesome. Great. Well, thank you so much, everyone. And here's to a kickoff. And a better tomorrow starts today. So I shall see you and have fun tomorrow. And okay, Alex, stop talking. Let's keep talking, you guys. Bye.
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 Bye.